Hi, in this video we'd like to go through why certain mothers during pregnancy they will experience this rare pregnancy disorder that we know as Hyperemesis Gravidarum. Now, to understand fully how it works, we need to begin with morning sickness. Morning sickness is considered a normal pregnancy symptom, a natural pregnancy symptom in fact, and almost 90% of women during pregnancy experience this. And the symptoms include some vomiting, some cravings of certain foods, here and there. All of these are very mild and will not disrupt your pregnancy journey. However, not all women will experience morning sickness, only up to 80 to 90%. There are women during pregnancy that will have no pregnancy symptoms at all, no vomiting, none of the nausea, none of the headaches, none of the cravings. They will lead normal, healthy lives. And all of these arise due to the presence of HCG. Now, HCG is the most important pregnancy hormone because it has several important functions. Now, the moment an embryo, fertilized embryo, implants into the uterine wall, the first implantation where it begins to burrow deep into the uterine wall, and then the trophoblast cells will go very similar to how a seed will grow roots. It will burrow deep to access maternal blood supply. So this is where the gas exchange happens, nutrient exchange happens, removal of waste products happen. It's very important for the growth and development of the embryo. And to help it burrow really deep, the embryo trophoblastic cells will secrete this pregnancy hormone known as HCG, human chorionic gonadotrophin hormone. And HCG has another important function, which is that it will stimulate the growth and development of the corpus luteum. The corpus luteum is another organelle situated in the ovary. Now, the corpus luteum has a very important function of progesterone secretion. Now, without HCG, it will turn into another organelle where there is no function and there will be no progesterone. And if there's no progesterone, then this pregnancy will quickly be terminated in a miscarriage. So that's why HCG serves an important function to actually stimulate the growth, the maturation of the corpus luteum, to make it sustain itself so that it can promote progesterone secretion. And when there's high progesterone, that means this uterus is well vascularized, there's a lot of maternal blood supply, optimum for the development, the growth of the embryo. And furthermore, it can also reduce the sensitivity of the uterine muscles, make it less sensitive to potential trauma, so that if it's very sensitive to contractions, if it's contracting a lot, then this embryo potentially can detach from implantation. Now, this is very dangerous for the pregnancy. That is why very commonly in threatened miscarriages, if you go for a potential management in any hospital, they will immediately prescribe you progesterone supplementation, because it's very common, but it's not effective for every single threatened miscarriage. However, the most common threatened miscarriage is due to progesterone, a lack of progesterone thereof, and it's commonly caused by low HCG. So once progesterone is high, it will actually promote the secretion of HCG with the embryo. So there's a cyclic relationship here. It's a positive feedback where high HCG will lead to high progesterone, and high progesterone will lead to higher HCG, and this will actually help the embryo quickly grow into the fetus, sustain the pregnancy for full term. Now, because the presence of HCG and the presence of certain receptors, now for women who have morning sickness, this means this receptor is commonly present in many women, up to 80 to 90%. And when HCG binds with these receptors, then you develop morning sickness, which are very mild symptoms. Now, for those that don't have any morning sickness, no pregnancy symptom, it means that they do not have this receptor, although HCG is present. Now, for those that develop Hyperemesis Gravidarum, these small number of patients, they have abnormal receptors. Very few women only have these receptors, and when they bind with HCG, they develop severe complications, severe stimulation of several glands, and an overall sensitization of the entire body. That is why we always observe them having severe vomiting of bile and blood, the severe nausea, the constant insomnia, excessive salivation. Now the root cause all can be traced back due to the presence of HCG and abnormal receptors. So I hope I've explained the concept as the mechanism of how these, whether it's morning sickness or hyperemesis, as to why some women don't even observe or exhibit any symptoms. It's all due to these two factors. At Antai Hospital, with our 2 decades of experience, we've identified that the best way to actually neutralize this condition is that we need to block these receptors from binding with HCG in the first place. And that's how we ensure that our patients can have a full recovery. Now, before you get pregnant, our treatment here at Antai Hospital is that we will firstly inject this HCG desensitizer into your bloodstream, and because it mimics HCG very similarly in molecular weight size, it will quickly bind with these receptors, blocking them. So during pregnancy, when HCG begins to flow throughout your system, they won't be able to bind with these abnormal receptors anymore because they're already taken out. And this way we can make sure that your symptoms can be well managed. We can almost guarantee there will be no symptoms at all, and success rate can be up to 95%. But it really depends on how soon you receive this treatment. The earlier, the better. So if you'd like to find out more information, or if you'd like to seek the treatment, please make arrangements to travel to Antai Hospital, especially before pregnancy or early weeks of pregnancy, so that we can ensure the best treatment outcome. For those that are unable to come to Antai Hospital, we can also make some arrangements to actually have this treatment sent to you directly to your home, but you need to appoint a qualified nurse or doctor to actually help you administer this treatment and observe this potential complications and treatment outcome. So I hope this video has helped you understand how hyperemesis actually works and how Antai Hospital can actually effectively treat this condition. Look forward to the next video as well.